Hello, folks. Welcome to another podcast of Inside the Marble Palace, brought to you by Post Media. I'm Murray Mandrick, political columnist for the Regina Leader Post and Star Phoenix. With me today, Arthur White-Crummey, our legislative reporter with Post Media, and Stephanie Taylor from Canadian Press in Regina. Thanks for joining us, Stephanie.
Thanks,
So good to have you. Let's start off with a new tough-talking premier who gave us a message up our yin-yang yesterday, courtesy, I guess, of Doug Ford, where he borrowed a word. Can you sort of explain what the premier was saying and maybe why he was messaging this in the way he is now? It was all centered, of course, around the need to get tougher with those rule breakers. What did he say, in any sense, Arthur, as to why he might have chosen this particular route to say it?
Well, he was reacting to earlier questions that had come up about the TAP restaurant and bar here in Regina, where there was that video of people that appeared to, that were dancing, in many cases without wearing masks. He said, in his words, that they were flagrantly violating public health orders, and decided to direct a warning to businesses that weren't properly enforcing public health measures, saying that consequences will follow, punishment will follow, and enough is enough. So it was a pretty strong, messaging from the premier. What I found interesting was that it didn't come right off the top. In his statement during the press conference, he seemed to be saving it for questions, and I believe it was in response to one of Steph's questions, so maybe she can give some reaction to that as well. But I think really the reason that he put so much energy into that warning is he doesn't appear to have any intention of toughening the existing restrictions on businesses, including on bars and restaurants. So this was a way of making it more about enforcement and following the existing rules than getting tougher on businesses that, in his words, are operating safely.
What do you make of that, Steph? Because it was your question. And I am fascinated by the fact that he did, as Arthur noted, save it till later, as opposed to making it the central message. Is there still a reluctance in your mind on the part of the premier to make enforcement, clamping down on business, his central theme, even though maybe other premiers have in the past? Certainly that's the case in Manitoba with Palliser, and to a certain extent even Ford and Kenny. Why does Moes seems to be less reluctant in that regard, and why, I guess, is he sort of maybe changing his tone now in your mind?
Well, I think Saskatchewan is trying to do something that not a lot of provinces have accomplished, which is try and keep as much open as possible and the virus spread manageable. We saw kind of Manitoba get to a point in a brink that they had to go to this really harsh shutdown. We saw Alberta get there. We've seen Quebec, we've seen Ontario. So if you're not going to bring down further restrictions to clamp down on the spread of this virus, then I think something's got to give kind of on the enforcement front. As one microbiologist I spoke to last week says, we're kind of at the point where everybody knows what we need to do to kind of stop the spread of this virus. And it's a matter of you have to either convince people to do it or compel people to do it. I also think perhaps the premier is speaking to people's emotions. Like, there are people, as I just said, there's lots that are still open in this province, but I mean, he focused on this signature, or the 10,000 or so signatures he said of sitting on his desk in a petition from parents whose kids can't play hockey or perhaps other recreational sports. And like, when that video emerged, and when there has been examples throughout this whole pandemic of people breaking the rules, people respond really emotionally of like, I'm making sacrifices. My kids can't go play the sport that they love. I can't go see my grandmother, but yet, a bunch of kids can go dance at a bar, or whatever that violation may be. So perhaps Moe responding the way he did, which we haven't really seen him do a ton of tough talk. I think kind of last summer was the last time I recalled him being super firm with just the general public and the actions they choose to take. But like, he must be hearing this from people. He must be hearing people being tired and frustrated. And we saw a little bit of this reaction too when casinos and bingo halls were still open, right? Like, regardless of maybe what the public health data said about how those businesses were contributing to the spread of COVID-19, I think people, when their daily lives are interrupted and things like kids can't go play sports, or you can't go play sports if you play adult hockey, for example, like when those are, and I think societally maybe people value that a little bit more than having your casinos and bingo halls open, although people who go to those and work there might feel differently. But like there is an emotional aspect to this pandemic, and I think the premier's tough talk was responding to people's emotions as well as responding to just the data that we're seeing about things don't seem to be getting all that better.
I think you're onto something. I'd just like you carry on with that for a second, if you don't mind, Steph, because I think one of the problems with Scott Moe during his 3-year tenure now as premier is that he's not a guttural politician. He does not react to situations as well as I think some people want him to. And I think COVID has brought that out. What he is a message track politician, and he's very good at delivering whatever message he's been asked to deliver. As you guys both know, it's pretty hard to get him off message track when he wants to talk about Trudeau or the carbon tax or even vaccines that I think we'll get into in a moment. But just before we do, is that the case in your mind, Steph, in terms of what you heard differently this week that you perhaps haven't heard in the past? Is this pretty much Moe finally finding a message he could react to in a good and positive way, and maybe delivering? I see actually nothing wrong with him getting tough on rule breakers. I think it's the exact message Saskatchewan needs right now. But might we see a different approach from Scott Moe and a sort of a learning process in terms of, hey, this is actually what people want to hear, and it's actually what I should be delivering? Do you think that's notion's kind of getting through to him a little bit more than it has in the past?
I don't know. And I mean, I think to be fair to the premier's office, he's probably hearing from all of the different voices, from businesses that don't want to close, from people who are afraid that the spread is going in the direction it is going, from people whose loved ones are in long-term care to people whose kids can't go play sports right now. So I think to be fair, he is, I think, having to choose, I'm not say choose what voices to listen to, but there's no shortage of people who are kind of talking in his ear about what they want to see. I think too, like Saskatchewan, again, I go back, like Saskatchewan is trying to do something that not a lot of jurisdictions have managed to do, right? So if you want to tell people, I don't want to bring down any more restrictions, but all the data is there to say we're the highest in terms of active cases, and even when we reconcile how many of those cases are recovered, we're not going to go down much. And you need this universal compliance. I don't know what other option there is other than to get tough with people if you need universal compliance, which I think in my question yesterday, I characterized as a bit of a lofty ideal, like to get human beings to all follow the rules while we are tired of COVID, where we are, having thing after thing that we have to miss or are just being disappointed into winter. So you can't really go outside in the same way you could in the summer. Like, other than getting tough with people to follow the rules, I don't know what his other options are, other than just to say we're not going to bring down restrictions, and we can talk all the ways about how that could damage their jobs, the economy, their overall well-being. So I see there's only like a couple paths he can really kind of message on and go forward. And so I'm not entirely surprised that there was this tough enforcement talk. And it's also worth saying that like there was no actual enforcement plan. Like he said, he had asked public health to see, is there a way we can kind of shut down that he characterized these businesses as bad actors? But let's see if there's any follow-up, right? Like I think Regina Police, for example, have only issued 10-ish public health fines. Saskatoon Police, similar. We have no idea from public health how many other tickets or enforcement actions have been taken. So I guess we'll see if this really leads to anything, even like an advertising campaign or more forthcoming messages in the kind of days ahead.
Do you see it as being caught with mixed messaging too, Arthur? What's your view of Moe's progress in terms of what he's been delivering to Saskatchewan people? Because I think actually, and we had this conversation as we were starting out, is he really making progress? Is the province really making progress on COVID-19. Yeah, things have leveled off someplace around 300 cases a day, which is better than maybe they were a week ago, but not much better. That's still enough to basically flood ERs and flood ICUs. It's still a situation where in January, with 70 odd deaths this month so far, we're headed for another record month after a record month in December. How do you think Moe is kind of squaring the circle, and do you think it can work, and can he ride it out, as Stephanie said, in terms of being able to find that place where he can keep things open, keep things going is the way they are, and yet still deal with the problems that keep COVID-19 cases from rising to a level where we can't deal with them anymore?
Well, I think both he and Dr. Shahab have been relatively consistent, at least since the holidays, that hospitalizations and the survival of the healthcare system as we know it is going to be the key, metric in making these decisions. They said that again very clearly yesterday, and on that basis, it seems as though Moe is continuing to rule out the possibility of any further measures once the current slate of measures expires on January 29th. Now, we'll see if we see another upsurge that legitimately cripples the system, whether that changes. But up to now, in the month that's gone, I don't really see mixed messaging in that regard, though it's clear that it's not the first thing that the premier wants to talk about. The first thing that he wanted to talk about yesterday was vaccines, and in his view, a dramatic reversal in the pace of the province's vaccination efforts, with now 15,000 vaccines distributed in just the past week. And any hiccups that we see going forward, it's clear that he's throwing the responsibility onto the federal government, as it's now up to them to make sure that Saskatchewan gets its supply. Said very clearly, we are going to run out of vaccines in the coming days, and we need the federal government to step up on distribution.
Are you surprised he's not even being a little bit more political, given how political he has been on most other things? It took less than a day for him to move forward on the whole issue related to Keystone XL and what Joe Biden will likely do. He hasn't firmly decided whether to cancel the project or not, but certainly he moved on that quickly. In terms of the vaccines, this is obviously something that he's aimed at the federal government, but it's a bit of a tough thing because they're also delivering a message as a province that we're doing pretty well compared to others in terms of getting the vaccines out, which in fairness to them, they actually are. And as a matter of fact, in some ways, maybe Saskatchewan and Scott Moe aren't getting enough credit for that. So what do you think is where he's going to go next in terms of the messaging on vaccines? If it gets tougher, does it just become another political message, or is there something more productive that he can do in terms of encouraging vaccinations?
I mean, so long as this is clearly just a production slowdown related to Pfizer's European factory, I think it's difficult to put all of the responsibility onto Trudeau. It's easy to absolve the province of that responsibility. And I think it's clear that he'll continue to say, we are ready. We have the capacity to deliver these vaccines. We're just not getting them. But if there's a clearer example of federal failure, dragging their heels on approving further vaccines, not getting vaccines to Saskatchewan once they are being shipped by Pfizer or other producers, then yes, I think we will see this politicized very quickly in much the same way that Keystone XL was.
So go ahead, Steph. Yeah.
Yeah, I mean, I don't know. I guess we'll have to just see where things go with the vaccine. But unlike other issues, I don't know what the appetite is for people in this province to really see a political fight between a prime minister and a premier right now. Yeah, pressure here and there, and standing up and advocating for the fact that the province just needs more vaccines and we're having to ration and prioritize because of supply issues, or just the fact that everyone wants vaccines right now. But unlike the carbon tax or Keystone XL, that there are these perennial fights that really don't ever get solved. And I know, Murray, you've talked about this before, that Western Canada fighting with the Prime Minister is just a thing we've talked about for decades past and are probably going to be talking about for decades forward. But like at the end of the day, people want vaccines in their arms. Like people want to see things successfully work. So I think the level of the level of how I guess highly politicized this gets, folks in the Premier's office, not just in Moe's office, but others, I think might also be looking at like, what is the public appetite for that right now? Like, does the public want to hear that level of rhetoric, or do they want to just see the vaccines get in people's arms?
You were thinking right, but if vaccines aren't getting into their arms, then they're going to be looking for someone to blame, and clearly the two levels of government are going to try to absolve themselves of that blame if it's at all possible. And one thing that I found very interesting yesterday was that the NDP absolutely recognizes that the vaccine issue is now on the top of the agenda and is trying to frame the province's rollout as disorganized and also confusing. They brought a bunch of residents who were chosen for their vaccination scheduling through a lottery by drawing names out of a hat as a symptom of that. It didn't necessarily stick as well as it could have, because the administrator at the home itself said that she thought the plan went extremely smoothly. But I think that's something that we're going to continue to see from the NDP in the days going forward.
I think you guys are making contrasting points, but I don't think either one of you are actually wrong. I think that there is going to be a politicization of the vaccines. But as Steph said, you really have to be careful in the political game of how tolerant you are, because sometimes I think you just come across as looking silly. And that's a pretty good example in terms of sort of how you might be pushing things a little too much one direction or the other in terms of the lottery draw at the care home. Obviously, people see it as a bit ridiculous and not being able to have that. But then they start exploring the issue and they say, well, this doesn't make sense. There was another great example of that, I thought, where he's basically repeating Ford's Doug Ford, Premier of Ontario's rhetoric about sticking a firecracker up the yin yang of the president of Pfizer. My God, Pfizer has 4 times the revenues of the province of Saskatchewan. I don't really think he gives a rat's butt what Doug Ford thinks, or certainly what Scott Moe thinks about. It's not going to change anything. Is he doing that just to basically sound like he's talking tough right now? I found that just not necessarily as off-putting. It was kind of funny, but just a strange way to go about things, because it's just going to draw the wrong kind of attention to Scott Moe's argument. In my mind, do you think that will go over good with some people, Steph?
I don't know, because I think there'd be questions that I think there'd be questions regardless of like, how often are you calling your federal counterparts? Like, what kind, if the Prime Minister is getting questions as to like, have you spoken to people at Pfizer? What is going on? The federal procurement minister, that only trickles down to the provinces of like, how have you advocated for this province with the feds? How are you pleading the case to make sure that we get the vaccine supply that we need as quickly as possible? So the language he chooses to use around that, I don't know how it's going to play over. I don't know if it's going to become a clip or a meme in the next few days. I have no idea this kind of strategy behind kind of parroting what Ontario's premier said on this one. But I think the province putting pressure on the federal government or Pfizer's president is to be expected a little bit. And the other thing is like, I don't know how much it's going to matter to people, because for all of the talk that the premier had yesterday, and even Dr. Shahab and the head of the Saskatchewan Health Authority, I didn't get any sense of like how they're adjusting the vaccine rollout plan. That is still a to be announced thing, right? Like, I don't know if they're going to slow down clinics in the next couple of weeks. I don't know if they're going to be sending these vaccines to different places where they weren't. Like, that was still really unclear to me from the press conferences. And I think regardless of all the tough talk, the actual like, how are you getting this done and how are you responding to it are still going to be the big questions in the room. And like, that didn't get answered yesterday.
So what do we watch for the next week or two as we just wrap up this podcast right now? It's obviously partly the numbers and whether they go up or not. Very quickly, as we close from both of you, do you think that the Premier has put himself in a position to take better action, more definitive action now, based on what he said and done this week, if the numbers continue as they are or remain high and they have to be a clampdown? Arthur, do you think he can sort of put himself in a position where he can say, yeah, here's what I told you before, I guess we have to clamp down now?
I didn't really see much signaling of that yesterday or in recent days. I got the clear sense that if we continue to see status quo or slightly rising numbers, that we're not going to see a serious clampdown. It would take something drastic that puts the health system into serious jeopardy, or else it would look like Scott Moe was backpedaling and coming down from what I thought was a pretty clear signal that we're going to see business as usual.
Is that your take too, Steph? Pretty similar?
Yeah, I think at least keeping the status quo, and then hopefully that things start to decline enough. And Mo has signaled, like, if things start to decline, he wants to look at the restriction of how many people we can have in our households, right? So I mean, the sense I get is that they and the capital that they are spending on the focus on the vaccine is like, they do not want to put any more restrictions in place than they do not have to, and it's still very much a last resort thing. Whether we see tougher enforcement or it just stays in terms of something the Premier said once at a press conference, I think is to be determined. How we see the Saskatchewan Health Authority in the province respond to the issues with the vaccine supply, how nimble the systems can be, whether it can keep up with the pace of vaccinations, with having to ration supply even more, how they message that. Like, that's kind of the stuff I'm going to be looking for.
Well, it'll be an interesting next week or two. And thanks again for doing this again, guys. It's offering a little bit of depth in terms of what's happening, these press conferences, and maybe why they're saying things. Until next week, we'll see you guys.
Thanks, Murray.
Thanks, Murray.